Hello, my fellow Americans. I'm Kerry Burns. Welcome to My Take. This is a new series I've decided to start to discuss different issues that not only are near and dear to me, but I'm sure possibly near and dear to a lot of you out there. One of the many topics that we're going to discuss through this, which I hope is a lengthy time period, is some of the pricing that's going on with the grocery stores and the food prices and fuel prices and energy in general. And we're going to talk about a lot of aspects of the agricultural industry and whatnot in this country. We're also going to talk about Obamacare, which we're going to do tonight. In tonight's episode, we're going to discuss Obamacare. And what I want to do is just offer my take on what I think about these various issues. Now, we're going to begin tonight with, like I said, with Obamacare, and this is really, in my opinion now, and I want you to understand that everything I say is my opinion. This is why I call it my take, is because I'm offering what my opinion is on these various subjects. But Obamacare, I don't think much about. For quite a few reasons, and I'm going to discuss them with you. My first problem with Obamacare is the fact that we force something on an American citizen that they may or may not want in the first place. They have no choice in the matter. This is what we want you to do, this is what you have to do, bam. And I have a lot of problem with that, being an American citizen. And, I've read our Constitution, and I understand what the Founding Fathers, meant when they wrote our Constitution. And they, after they had done our Declaration of Independence from the Crown and all, and they had wrote our Constitution, I don't think that there was any part in there that said that they were going to force a person to adopt some sort of medical insurance just because, we decided that's what you should do. And, a lot of people out there may want Obamacare. They may need the Obamacare. They may feel like that they are in some kind of jeopardy because they don't have some sort of insurance coverage based on some sort of catastrophic event or whatever, or health malady or whatnot. And that's all well and good if that's what you choose. If you feel like that paying monthly premiums for a health insurance for, I'm sure, varies an assortment of different types of medical treatments that you can get with it and all. If you can afford and pay those monthly premiums, and that makes you feel better about being covered, then of course this is something you should choose to do. But there are many Americans, I'm sure I'm not the only one in this country of 330 million Americans, but I'm sure there are many like me who don't use the medical field. I don't go to doctors. I don't, if I get some sort of sickness, which is rare, I don't, just jump up and run to the emergency room or go see a doctor or anything like that. It's something I just totally avoid like the plague. And I do this for many reasons. I have no faith in the medical field, first of all. They're not educated enough, 4 years after college, to take on the job of caring for somebody's health and having their lives in their hands and all. And I'm not trying to thwart or talk down any of the doctors or any of the people in the medical field or anything like that. I'm sure there are a lot of brilliant doctors out there. I'm sure there's a lot of brilliant nurses. There's a lot of capable, caring people that do their job every day, and they're devoted and are devoted to helping people and healing them and curing them. And for the people who trust you and all of the ones like you, I applaud you if that's what you need to do to go and have your health taken care of. But one of the biggest problems I have with Obamacare is that there's nothing stressed in there about citizens taking care of their health. There's nothing in there about, setting guidelines for people apparently that don't know how to eat right or eat the right foods or grow the right types of foods without pesticides and different types of poisons on them. there's no guidelines out there for these people to follow and how to take care of their health. The reason I don't go to doctors and have avoided them like the plague and all is because I try to take care of my health. I try to eat right. I try to rest when I can. I try to work hard. I do everything I can possibly do to keep my health at a premium as I can. And I'm not one to believe that going to the medical people is the sovereign of healthcare. To me, if you've gotten to the point where you go and you trust the medical field to fix you or straighten out whatever's wrong with you, then you have reached the pinnacle, not of health care, but of health failure. This is the point when the failure of your health has taken over. And the beginnings of taking care of your health should have begun long before that. And that's kind of a problem I see that this is going to develop, is that people are going to rely so heavily on the fact that they now are covered and they have this insurance and all, and they were just trying to live healthy out the window. Oh, if I get sick, well, I'll just go to the doctor and use my Obamacare, and they'll pay for it. All I gotta do is keep up my premiums, and this is just almost absurd. My opinion, of course. I think that probably that if you had, instead of making people shell out, say the minimum premiums, and I'm sure they're higher than this, but say that the minimum premiums each month for a family of 4 was around $200. I do believe that you'd get more bang for your buck, more health care for the family, if they were allowed to take this $200 and buy healthier foods than they're eating right now. And certainly eat foods that they can't afford right now because they're shelling out, $200 and beyond for this Obamacare in case they have some sort of medical malady that they've got to rush to a doctor for to make sure that they don't go bankrupt over. And there's no mention of how people should take care of their health. And I just cannot even believe this in one thought of anything. I do believe that it would have been way smarter to come up with a plan, and I'm sure everybody could have agreed on this, that how to show Americans how to stay healthy. Because when you go to the doctor, you go to the hospital, the emergency room, or on some medical emergency and all, this truly is health failure. It's not health care. This is health failure. You're going to seek help for basically your health going in the gutter and whatever malady it's caused. But a lot of the issues that I see are going on out there, particularly there's rampant amount of cancers that we're seeing, and the different illnesses and stuff that are going around. A lot of this is being caused by pharmaceuticals that are being prescribed by the medical industry. And it's these long-term use of these pharmaceuticals, whether they're taking them at the recommended dosage or they're abusing them. Either way, the physical debilitation that these are causing, and I do believe is one of the root causes of a lot of the medical issues that people are going through today. And if you take these people who are prone to go to the doctor every time they turn around, particularly parents who take their children who just with this, a cold or runny nose or something, boy, they run them off to the doctor and start, antibiotics and just a whole bevy of things. And then you live in a society now where the neighborhoods and the homes, we all have, not we all because I don't, but in these neighborhoods and stuff, particularly in these areas where the home groups, they control everything in the neighborhoods and all. They send the people around once a month to do a perimeter spraying for insects around your home, and not even thinking about how detrimental this is to your health and all. And we have every toxin under the sun under the kitchen sink that we clean with on a daily basis. We wash our clothes with toxic types of detergents and just pretty much, we grab the wasp can spray when we see a wasp nest outside because we've got this god-awful fear of getting stung by a wasp that's in a nest 20 feet above our head. And we our whole society, people they garden with all of these pesticides and dump chemicals on stuff and food that they're going to eat, and then we wonder why our health fails us. When you go through a long time where you're constantly abusing your body to pollutants and different types of pesticides and dangerous chemicals, and then you're running and compounding that with pharmaceutical use from prescriptions like antibiotics and painkillers and manic depressants and whatnot. All of these add to this sum total of health debilitation, and this is where the areas that I think this bill is failing. Now, if there are people out there who need insurance, if they need medical assistance and choose to go that path and all, and they can't afford it, and I don't know how, they weren't paying $200 a month for these premiums before Obamacare came along. How are they affording to come up with $200 more each month? Just for the sake and fact that they can be put on the list of those that are covered. And I really don't even know how much, medical insurance, that they get for that $200, nor how much medical care they get for that amount of coverage. I mean, it really must be a crapshoot, and I just think that it's wrong in this country that we force and mandate something like this on citizens, particularly those like myself. I use herbs. I drink herb teas daily. I just incorporate them in my daily life, just like I do eating and sleeping and walking and exercising and whatnot. This is just, do it just pretty much like breathing. And if there are times when I feel like I'm under the weather a little bit and all, I'll make a stronger tea and drink more of them. And the sickness usually passes really quick. And I don't feel like I have to run to a doctor's office that is, first of all, infested with sick people that really do have, some serious issues going on that I don't really want to expose myself to just because I have some sort of, runny nose or cold or a little ache or pain or something. I don't know what it is. I mean, there's just so many things that you've got to do before you go to that point of having to visit the medical people. And unfortunately, it's taking care of your health is the least priority for most of the people. I mean, probably the top priority right now is them trying to come up with the money each month to pay their premiums to make sure that their coverage stays intact, because any of you that have bought insurance out there before, you know what happens if you miss a payment or two on your premiums, usually just one, you're sent the letter of cancellation. And it also makes it very difficult for you to get insurance from another carrier if you have that on your record and all. So and from that point of view, it's just kind of a setup for people who, if they had never had that put on them in the first place, would have never had that bridge to cross. And I think that this is a very important point, that healthcare should first start at home, should start with the individual, should start with your daily life. Look at the types of food you're eating. Look at the type of food that you're feeding your family. There's plenty of knowledge out there. There's plenty of facts out there that talk about all of the wrong types of foods to be eating. It is not rocket science. And if you look in the pantry or you look in the skillet of the night meal that you're making for your family and all, and you see things that you're cooking that are, could cause serious heart issues or cardiac problems or pulmonary issues later, or God knows what the meat that's being sold in the markets today, what it has on it and all. But if you truly really care for your families and whatnot, isn't it important that this become top priority? I mean, you really need to address this situation, because what you eat and what you consume in a given day is pretty much responsible for how your health and how your health is going to dictate the future is going to hold for you. And of course, you need to exercise also. I'm not saying that it's not just eating. And one of the simple things that you can do that a lot of people really don't do enough of, and that's drinking 8 glasses of water a day. There's so many people, particularly in the cooler months from the fall through the winter and all, they just do not drink enough water, and that in itself will cause lots of health issues inside your body. And it will prevent a whole lot more if you do just take on that simple practice. Just make it a routine. The way I do it, I drink from a quart jar, and I fill it up at least 4 or 5 times a day. And I know when I get to the bottom of it, that it's time to fill it back up until I get to the end of the day. And this way, without even thinking about it, I know that I'm drinking enough water. And this is one of the things that I do for myself to take care of my health. I don't run off to a doctor. I use herbs. Like I said, I grow my own herbs. I grow them organically. I don't use pesticides. I try not to use any type of chemical stuff. I don't do any type of spraying outside. I think I don't have problem insects out there. I've got life out there. I've got salamanders, amphibians, frogs. I mean, you probably heard the frogs in this video. They're out there, around the edge of the pool out there that they're trying to turn into a pond. But I don't think that my life and the way I live my life is something that's hard to do. It's very simple for me, and I think it's a simple thing that everybody out there could do. And this is what needs to be stressed with Obamacare. Is first and foremost, do everything you can within your power. Adjust your diet, exercise more, drink plenty of water, avoid substances that are damaging to you, debilitating to you. Avoid prescription drugs at all costs. Avoid prescription drugs if you can. I know a lot of you are on prescriptions and stuff you've been on for a long time, and you're just probably downright scared to even make any kind of adjustment in that. And that's probably damn true, because a lot of the chemicals and stuff out there and prescriptions and whatnot that are taken for a long time, they cause serious problems after your body doesn't have them anymore. And I think that's part of the plan for being able to sell more pharmaceuticals. But irregardless of that, look at your health. Look at the whole quotient of everything you do in a given week, in a given month, through a given year. Try to grow your own vegetables. Grow them organically. Don't use the pesticides. I've run an organic nursery for over 25 years, and we've never sprayed not one time have we sprayed one drop of any kind of pesticide. Not one time have we used any type of commercial fertilizers or any type of stuff that's not organic. We treat everything, we approach every plant we grow, everything we do from an organic standpoint, just like I do my life. And this is not hard to do. I've had as many as 5,000 containers growing at one time and never had one problem of insects or anything. And your health and your life and whatnot follows this same pattern. And if you really adopt an organic lifestyle, you don't have to worry about Obamacare. You don't have to worry about making sure that you have medical insurance paid up just in case you have some sort of anomaly show up, because it's not going to happen. And that's what needs to be stressed. We need to stress to people, please learn how to take care of your health. And that crosses many, many lines. But it's very simple to do. You just need to kind of get up above it and look down on it and figure out what works for you. And I'm sure if you adopt these practices, your health will improve vastly in a very short amount of time. I know this to be true. And I thank you for joining me for the first edition of My Take. I appreciate all comments from everybody out there in the medical field or not in the medical field, whether you're like me and you use herbs, or whether you go to doctors and take prescription drugs. That is your choice. And we are just offering, I'm offering my opinion and just a different way to look at things. And I believe that this is sound advice, and I stand behind it, and I bank my health on it. And I thank you once again for visiting this channel.